Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Ané Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey Vet Rehabbers, in this episode we're speaking to Priya Streram from Singapore. She has been on the podcast before, but this time we're going to be chatting about one of her favorite topics, and that's applied anatomy. And what makes the conversation even more special is that she's joined by our very own Ané, so you'll be getting two anatomy-obsessed minds in one. Now both Priya and Ané have created fantastic resources for the vet rehab profession. Priya is the brains behind the Applied Anatomy course, which is available through the Veterinary Academy of Higher Learning. And Ané is the author of Canine Muscle Anatomy Simplified. So having them both together to unpack how we can move beyond theory and bring anatomy to life in clinical practice is going to be awesome. They chat about what applied anatomy really means, how it supports clinical reasoning, and how it helps us to spot compensation patterns and really just allows us to dig deeper than just the obvious diagnosis. Priya also shares some insights on myofascial trigger points and loads more. There's also a little bonus for you from Val, so you can head over to onlinepethealth.com/anatomy course. All the podcast listeners will get a special discount to that applied anatomy course. Now, the Vet Rehab Summit 2025 is happening this year on the 8th of November, and the theme this year is Dynamic by Design. So we're going to dive into canine and equine anatomy and motion. We're going to explore biomechanics, muscle activation, movement science and practice. It's a full day of inspiration, learning, and connection, and it's all happening online. Now, our early bird tickets are officially live, so you can grab yours now with a $100 discount, and this is your chance to lock in your spot at the biggest event of the year for vet rehabbers, and it's going to be at the best possible price. So don't wait. Your early bird tickets won't last for long. You can head over to vetrehabsummit.com. A quick word from our sponsors before we dive into today's topic. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, our brands Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, Muffins, Halo, Sleepy Pod, and Canine Cards offer effective, innovative, and proven solution. Sign up today to receive a one-time special gift for all our listeners. With your next order, you can just head over to pawprosper.com/OPH. And of course, you'll be able to see Paw Prosper and all their brands on the 8th of November at the Vet Rehab Summit. Right, over to Priya and Ané.
Hi guys. Hi Priya. Thank you so much for joining me.
Hey Anne, it's such a pleasure to be here with you today.
We're going to be talking about applied anatomy. And it's quite an awesome topic for Priya and I to be chatting about, because we both really love anatomy and we've both created these awesome learning resources within the sphere of canine anatomy. So we'll talk more about that today. Priya, will you please introduce yourself and let us know where your love for anatomy comes from?
Hey everybody, such a pleasure to be here. I'm such a big fan of Online Pet Health, and it's an absolute honor to be able to share this space and time with you, Anne. So my background is that I'm a veterinarian. I studied in Melbourne, and currently though, I own my own business. I run my own rehab practice in Singapore. So it's been quite a journey getting, from a very conventional veterinary practice style career to then coming out of the norm and discovering what is it that I really like and stumbling upon rehabilitation, physiotherapy, and then going like, oh my God, actually, I do love anatomy. This is so crazy because it's one of the subjects that I totally hated in vet school. It was so dry. I don't know if that's your experience as well, Anne. Like,
My experience with anatomy as a student is it's overwhelming. I don't know how anybody takes that as a first year subject and doesn't just die, honestly. It is so overwhelming.
Yeah, I know. And especially when it's like something so new, like we never, I mean, yes, we love pets and stuff, but we've never really like learned about muscles, tendons, ligaments, arteries, veins. And you're here dissecting this dog and going, how the hell am I supposed to remember all of this? So yeah, I didn't.
Well, a completely different language, right?
Yes, exactly. And knowing the origins, the insertions, and they don't even cover like, the fascia as well, right? It's like there's so many aspects to anatomy that they just don't cover. And knowing what is relevant to me as a practitioner, as a clinical practitioner, that was really hard. And needless to say, that was year 1 and 2. And then as you go through vet school and you get into like final year, and you're like, all right, this is just the extent of my orthopedic assessment. How do I feel for patella luxations and cruciate ruptures? And that's pretty much it. We don't even think about soft tissue. So that in itself is like an entire podcast. And I'm sure you've interviewed other people regarding that. So yeah, so that's where I think my love for anatomy came from, because it was so relevant to being a good clinician, a good rehabilitation practitioner, knowing when is it pain in like the joints, when is it pain or stiffness within the fascia, the connective tissue, and to be able to distinguish between that and have an appreciation for that, and coming up with a treatment plan that addresses the right thing. You need to be able to know your anatomy, So yeah, I guess that's a little bit of a background.
Okay, so Priya, can you define for us, we talk about anatomy and then we talk about applied anatomy. What does applied anatomy mean to you?
So applied anatomy, what is it, right? It is essentially the clinical application of the knowledge of anatomy. So what is it that I need to know about anatomy that's going to clinically enhance my skill as a rehabilitation practitioner, or as a veterinarian, or as a hydrotherapist, whatever field you may be in as a veterinary professional, paraprofessional, and the course or like the subject is actually created to clinically enhance your knowledge and application.
Okay, I really like that. So very much taking that theoretical knowledge that is first year anatomy, which is highly overwhelming, and then bringing that into the space where we can apply it to our patients and what's in front of us. I like that. Thank you.
Yeah.
Okay, so in your experience, what are some of the most common missed connections between anatomical theory and that clinical application?
I feel that in theory, we learn so many things about different muscle groups, right? It's like, okay, we have this muscle and this muscle does this function. Let's say like the shoulder. The shoulder is like the most complicated part of a dog's body. And it's so closely associated with the neck and the skull. And we don't really talk about, okay, if there is pain in this area, how does it relate to how the dog is going to move its front leg? If the dog is limping in the front leg and you feel pain radiating down the limb, what are the potential differential diagnoses? So when we learn anatomy, like in vet school or other sort of like a very traditional practice, right? We're learning it in isolation to function, when it shouldn't be taught that way. It should be taught from a perspective, okay, the dog is presenting this way. What are the potential structures that could be causing the dog to move this way? Shortened stride lengths or reduction in extension. I think even up to the point where I was studying rehab, when I found, reduction in extension angle of like the shoulder or the hip, I just thought, oh yeah, the dog has a hip joint issue, Whereas now I know that if the dog doesn't want to extend its hip, Yes, it could be the hip joint, but hey, hello, iliopsoas pain. Maybe that area is really tight and painful, so the dog doesn't really want to stretch out its hip. So, knowing this actually helps you kind of go, all right, let me check for psoas pain. Let me check for like tightness in its adductor muscles. And so I think that's where the gap is between your traditional theoretical learning from the textbook or from vet school versus like what we've created, which is like applied anatomy.
Okay, I really like that. Well, and as you were talking now, I was thinking about the adaptability as well of the body, in that, yes, we learn that a muscle has an origin, insertion, and a function, but so often when the body is compromised, if we're dealing, for example, with an amputation or a chronic injury, or there's some change to the body, how do those structures, how do those muscles adapt to take over the function of the damaged tissue? Because it does, and they do. And I think that is really interesting. So I love the, going into the neurology as well, which again, it's just a
Yeah.
whole nother level of overwhelming and very interesting things to talk about. But the body is just incredible. I love it. Priya, you've mentioned a few times that you've created something. Can you tell us what you've created so that we're all on the same page?
Yes. So what I created, let me just explain the intention behind the creation, right? So the intention in terms of creating this applied anatomy course was to simplify learning anatomy for people who not necessarily have had like a veterinary background training, like gone through vet school. Because I do realize and recognize that many of the professionals in our field of rehabilitation and hydrotherapy, canine massage therapists, they may not be veterinarians themselves. So they may not have had trainings where, yeah, we're going through musculoskeletal anatomy in a very old-fashioned way. But also for vets like me, who did not remember anything past second year anatomy, to be able to have like a refresher course in a way that you feel empowered to kind of step into that consult room and know what you're checking and what you're finding from your clinical assessment. So the course essentially is an anatomy course, and what you will learn from it, or what would a person learn from it would be, yes, we are going through the bone structures, the muscles and tendons, but hey, if I find pain in this area, what does that mean? Or if I find restriction in joint range of motion, what other structures should I be looking for? What other, soft tissue pathology may be there that could translate to this clinical finding? So that's what the course is about. And it's broken down to 3 segments where we go through the front leg, so going through shoulder joint, elbow joint, and the distal antebrachium. The second segment is the spine, so talking about the neck, thoracic spine, lumbar spine. And then the third segment is about the hind limbs. And so we have videos demonstrating these muscle structures, demonstrating trigger points that are in the common muscles, that we can palpate, and also short videos on how I do the clinical assessments of these areas. So it's very comprehensive, and I think it's very relevant for anyone who wants to upskill their knowledge on anatomy and kind of get an idea on how should I check for pain and dysfunction in these particular parts of the body.
I think that is so important, Priya. I'm really glad that you created that, because truly, as a professional, like, first year anatomy is very hectic and very overwhelming, and I don't remember things that I don't think are important or like clinically connected. So remembering, and this sounds very counterintuitive, but memorizing and remembering all of the little details of anatomy, I just didn't. It was just too much for me. So being able to come out as a professional and then say, hey, let me refresh my knowledge of anatomy, I think that's really amazing. So thank you so much for putting that together.
You're very welcome. And you know what? And like I feel that sometimes like we want to be able to remember everything, right? And we're like, oh, if I remember everything, I am going to be a great clinician. But the reality is we just have so much information to remember that you just can't. Your brain just physically can't remember everything. So what is it that is important to remember? So I think that's what the course kind of focuses in on.
I love that. Thank you. So, Priya, how can understanding the relationship between muscles, joints, fascia, how can understanding that really well help us make better treatment decisions?
All right. So I think as a clinician, right, like I often get referred dogs with like hip osteoarthritis and causing weakness in the back leg. And on my clinical assessment, most of the time, the reason why the dogs can't get up and walk, it's not because of the hip osteoarthritis. Yes, of course, it has weak hips, weak joints, probably weak muscles. So the dog is struggling to get up. But what is limiting pain is maybe back pain, so the muscles in the back, they've been working and working and working so hard that it becomes so tight, so painful that the dog can't stand up anymore because it's just too painful to do that. And I think, knowing like the anatomy of the area, knowing how to check areas for pain, and knowing that myofascial pain is a real thing. That is so important. Like, and that will be able to go kind of influence your treatment plan for this patient. And go, all right, I know that the dog is very prone to getting, hypaxial muscle pain here, and these muscles, the paraspinal muscle pain here, and that is the area that's really very stiff and sore for the dog anymore at the moment. So instead of just lasering the joint or doing acupuncture for the joint, part of my rehab plan is going to be targeting the myofascial pain in the back. Or maybe this dog, what's limiting the dog's mobility is its shoulder muscles are so painful. It's got triceps trigger points, deltoid trigger points. Maybe it's got a biceps tendinopathy because here in Singapore, most of the dogs walk on tile, like slippery surfaces. So it's very common that they try to get up with their front legs and they keep doing the swimming motion. And then they end up injuring the tendons and the ligaments in the medial aspect of the shoulder. And this then limits their mobility. So knowing that, all right, I know how to check for soft tissue pain, I know how to check for myofascial pain, I know where to feel, and that will kind of influence your care plan, and that would ultimately make a difference on how the dog recovers with your therapy plan. So I feel like knowing anatomy, knowing the structures, knowing the clinical application in terms of okay, which muscles are going to be mostly affected. Triceps is a big thing. Like I didn't even get taught about triceps trigger point in school, like in vet school. But I didn't know it's a thing. I didn't know it could limit mobility. So yeah, I think this information is super, super important because it will directly affect your patient's response to what you do.
Yeah. Anatomy is the foundation. It really drives our clinical reasoning in all the ways. So I think that was a great answer. Thank you, Priya. Okay, Priya, what advice do you have for vet rehabbers who want to improve their palpation skills, but also that visualization of what is under their hands that you spoke about in the beginning?
Well, all right. What I did, okay, this is what I did, right? And this is how I learned. But I feel like a lot of people can relate to this because the more I speak to people, they're like having the same issues. So I was learning from textbooks. So when I was doing rehab, that's when I relearned entire anatomy, right? So I was learning from textbooks, and I went through like, all right, muscles, tendons, ligaments of the forelimb. Where did they insert? Where do they end? Because from my clinical assessment, so when I was actively doing cases, I was like, oh, okay, this dog has like limitation in shoulder extension, but I don't know if it's joints, what other structures could limit the shoulder extension. And so I went back to anatomy books and tried to kind of learn about the structures in that area. What was I feeling? So it was a little bit of like going back and forth between textbooks and then what I was feeling in the body when I was checking the dog. Palpation skills came along kind of from attending CCRP. I found CCRP and learning from the lecturers and the tutors that are there. I learned from Dr. Daryl Millis. I learned from Dr. Barbara Bockstaller, Marion Muka. Like I learned so much from these people. And I took away that knowledge, and went back and was just practicing a lot of palpation. So like I actually volunteered at a shelter just so that I could see a lot of cases, feel a lot of dogs' bodies, and referring back to textbook and doing clinical things is how I learn best. At that time, I didn't really have like a resource which was very clinical. I know, Anne, you have created a very lovely like book as well on anatomy. I wish I had that, but it was not available then. I only had Miller's Guide to Anatomy, I think, and then the Rehab textbook. So that's all I could work with.
Okay. Yeah. So let me tell you about what I created, guys, so that you're also aware of that. I am redoing my veterinary physiotherapy degree at the moment, which is super fun. But basically last year I retook first year anatomy. And like you say, Miller's Anatomy is basically what we have in terms of a canine anatomy book. And it is an amazing textbook. Amazing, right? But for a first year student, that is so hectic. So trying to decipher origin, insertion, innervation, function out of all of the text in Miller's Anatomy is quite a job. And I found that most of the students were creating some form of chart or cheat sheet or something where they summarize it all together for themselves. And we also don't have images of the individual muscles. So I decided to fix that. And I illustrated all the individual muscles of the canine body, that not all of them, but all the ones that are relevant to us. And then I put that into a book that's called Canine Muscle Anatomy Simplified, because it summarizes it for you. It is the basics. It is the image of the muscle with the origin, insertion, innervation function listed clearly next to each muscle. In terms of like how the body works, we know that the body doesn't work in isolation like that, one muscle at a time, but our brains learn best when we break it down one muscle at a time. So we created that, and I think it's a fantastic resource. Lots of people love it. So I'll share that link with you guys, and then you can have a look at that as well. And we're actually going to put together a little discounted offer between Priya's anatomy course and our anatomy book, so that you guys can benefit from both of those spaces, because they are complementing each other in a really great way, right? The anatomy book is the foundational knowledge, and then Priya's taking that into an applied space, which is fantastic. All right, Priya, do you have any favorite anatomical structures that you think often overlooked, but they actually play a really big role in movement dysfunction? You've already said the triceps, so you can't say that again.
No, yeah. I just gave away my favorite ones, the shoulder, neck. But no, okay. What's got me really interested lately has been the biomechanics of carpus, the wrist. I don't have to say wrist. I usually like speak to pet owners and I'm like, yes, the wrist. So I don't have to say that. Carpus and the tarsus. So the hock and the carpus. So what I learned, not recently, but at the CCRP course that I was tutoring in 2023, must be 2022, was that dogs actually need a huge range of motion in their carpus to be able to move properly. Like with all other joints, including the shoulder, hip, like you could lose quite a considerable amount of range of motion and the dog is still walk. But with the carpus, as soon as you lose like certain amount of range of motion, the dog's gonna have problems like stepping up things or, navigating obstacles. So like carpus range of motion is really important. So
I should focus a lot on doing passive range of motion, like teaching people how to properly do passive range of motions for the dog's wrists and ankles, to make sure that we try to limit the joint capsule from tightening too much. Even addressing like any sort of stiffness in like the muscles and the tendons around that area, so yeah, that's kind of like what is sparking my curiosity at the moment.
Oh my gosh, that's really interesting. If you're like, let's go into that a little bit more, because the carpus is often a joint where an arthrodesis is an option if there's, there are issues in other space, like whatever. Can you talk to us about a carpal arthrodesis and when that would be done, and should we not be considering them? I think they're usually last resort procedures.
Yes, and the last resort for a reason, and because it really does significantly alter the dog's mobility. And I have a dog, like it's a toy poodle. She's still alive. She very unfortunate little dog, she's somehow broke her bones, and it affected down to the joint, to the carpus. So she's got a carpal arthrodesis in the right forelimb. And then a couple of months later, broke her back leg. So on the contralateral limb, she also has a fracture repair. So she's like, this poor little thing is just, compensating so badly. She had really poor posture. She's very very curved in the spine because she's trying to take the weight off like both these legs. She had stiffness, like myofascial stiffness on the other two limbs. So I think like, carpal arthrodesis in most cases, it when the surgeons decide to do it, they really need to do it, right? When the flexor tendon is like so significantly like affected, or if there's instability in the joint for whatever reason, or if the osteoarthritis is so severe that maybe they really just need to fuse the joint, clean up and fuse the joint, then maybe like that is like a decision that would help with improving the quality of life of the animal. But surgery is not the end for that animal. Like that animal really needs like an active rehabilitation program, the client to be educated as to like, hey, okay, so these are the compensation issues that are going to happen with your dog. These are the problems that they're going to face, because some people, I had this with a dog that had a cat that had a hock arthrodesis. When is my cat going to jump on top of the table? I'm like, I don't think that is going to be possible with that leg, because it's not going to be able to flex enough to get the load and the power to make that jump. So how about we break the height so that your cat can still go up the table and not have compensation issue in the other leg, because the cat is a British short hair with hip dysplasia. So so these are the things that are really important to know, like what are the significance when a pet, cat or dog, loses range of motion in these joints, and how is it going to affect their mobility? Because if we kind of turn a blind eye and go, oh yeah, that pet's like solved, the surgeon's like, surgery is a success, yes. And then down the road, the cat's like, nah, I'm like aching in other parts of my body. So is it really a success? You know what I mean? So yeah, I think it's really important to know when is it okay to lose range of motion, and how much range of motion can you lose before the animal starts really compensating. And when is it like, hey, we really need to pay attention to this, because any loss of range of motion here is really going to affect the mobility in the long run.
How do you support your owners with dogs that have had something like that, in terms of, are you teaching them how to spot compensation in their dogs, and are you teaching them ways that they can bring pain relief, or are you recommending that they are seeing you on a more regular maintenance basis? How do you make sure that these dogs have as long and happy and healthy lives as possible?
Yeah, so like our practice has kind of evolved over the years. So I've run this business for like 5 years now. And initially I was like, I got to do everything. And then I realized that, hey, I can't do everything. And for the animal the goal is always the pet to have the best pain-free, comfortable, functional mobility for the rest of its life. And the only way I can achieve that goal for my patient is if I start helping the pet owners understand what they need to do. So now we're very education based at the practice. And obviously, initially, there's a lot more like, okay, we work with the pet owners on a weekly basis. So this particular poodle that had that issue, it had a carpal arthrodesis and a repaired fracture in the contralateral hind limb. That dog didn't have very much pain, but if pain was present, we would teach the client how to do either a warm or cold compress, depending on the situation. And then I'm a big fan of lasers. It doesn't necessarily have to be a class 4 for home use. Like we advocate for class 3B lasers for home use, and they're really very effective. So we teach people how to use a class 3B laser at home for pain management in a safe and effective way. And then my practice is also focused a lot on exercise. I'm a huge believer of exercise, but not just like any exercise, the right kind of exercise, you know? And so currently we're like working with people and teaching them, all right, these are the exercise that we're doing. This is the program I want you to do. And then we check up on them like every month or every 6 weeks, depending. Some people need more guidance and they're happy to come like even as frequent as every 2 weeks. They're like, you know what? No, I know my dog enjoys these sessions. I know that I can see that my dog benefits from it. So now that poodle, which was the shape of a banana before, is like actually a long dog. So we were all surprised. We're like, oh my God, Sandy, you're really that long? Because she was always a little banana. And yeah, so when they can like clinically see the improvements, right, then they're more keen on learning like, hey, okay, how do I maintain this? And especially when it comes to rehab exercise, everybody thinks that exercise has to be super crazy. Like, you know, oh, my dog has to like run this much and jump these hoops. And no, actually, like a lot of the gym-based exercise that focuses on, you know, neurocognitive training and proprioceptive training, you know, enhancing that pathway is really very important. And that's where all of it starts. So yeah, I feel like education is what we do, what we focus on. We teach people how to help their dogs, and then we support that process. And that's what creates longevity with our client in terms of our client relationship and also for the pet's mobility.
I love that. I think that is a really good way of approaching it, because like you said, you can't actually do everything. It's not sustainable for you or for the pet owner. So yeah, I like that. Thank you. Okay, Priya, thank you so much for your time today. It's been really awesome chatting to you.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.